Good afternoon, participants. We continue with this webinar. I now request Annie Thomas Thornton, Head of the Department of Clinical Nutrition and Dietetics, to welcome the gathering.
Good afternoon to all. Respected Reverend Dr. Sister Vinita, Director of our college, respected Principal Dr. Lissy Matthew, dear Lekha Ma'am, Center Coordinator, Women's Studies Center, enthusiastic participants, a warm good afternoon to one and all. The whole world has been influenced drastically by the coronavirus, invisible to the eye. Our routines have changed, our lives have changed, our country has changed, the whole world has changed. This webinar is a humble effort to gain some scientific insight on the know-hows of this pandemic that has affected the rich, the poor, the old, the young, and people belonging to all walks of life. Without much delay, let me move to the duty vested on me to formally welcome this August gathering. I welcome our beloved Director, Reverend Dr. Sister Vinita, who is guiding force, is a backbone of this institution. I welcome you, Sister, to this webinar. I cordially welcome our dear Principal, Dr. Lissy Matthew, who encourages and supports us. I would like to welcome Reverend Dr. Sister Teresa and Dr. Sajimol Augustine M., the former principals of our college. It's indeed a great pleasure to welcome Lekha Ma'am, who is a strength and support system of our department. Welcome, Ma'am. I'm quite honored to welcome our eminent resource person, Dr. Jibin John Thomas, MD, with a diploma in diabetes. I would like to tell a few things about him, even though it's a welcome address. An intellectual physician with excellent diagnostic skills, trained from Amla Institute of Medical Sciences during his undergraduate years, did his post-graduation in internal medicine from United Kingdom and has been trained in multiple hospitals there. To add another feather to his cap, recently he was awarded diploma in diabetes from the famous American Diabetic Association. Dr. Jibin worked at Believers Church Medical College Hospital for 5 consecutive years, and his portfolio there included consultant physician, chief medical officer, teacher and trainer to medical undergraduate students. He is presently working at Al Abir Hospital and Medical Center, Kuwait, as consultant physician and diabetologist. He has several publications and is an expert in diabetes, rheumatoid disorders, hypertension, endocrine disorders, infectious diseases, respiratory, cardiac, and neurological problems. Once again, I wholeheartedly welcome you, Dr. Jibin. A special welcome to my mentors, my senior teachers, teachers of other departments of our college and other colleges, doctors, dietitians. I'm extremely happy to welcome such a diverse crowd for our webinar. Let me take this opportunity to welcome all the students of our college and other colleges, alumni, and all participants of this webinar, and wish that you may be enlightened on the topic COVID-19, understanding the real threat to human. I welcome in a special way the Women's Studies Center, my family, each and every faculty of the Women's Studies Center to this webinar. I also welcome Ms. Dia, the technical support. Praying that you have a fruitful time in this particular session, I welcome you all once again to this international webinar. Thank you. Can I request Lissy Ma'am, our principal, to go forward with her speech?
Respected and beloved Director, Dr. Sister Vinita, guest speaker of the day, Dr. Jibin John Thomas, Coordinator of Women's Studies Center, Srimati Lekha Srinivasan, Head of the Nutrition and Dietetics Department, Ms. Annie Thomas Thornton, other faculty members, and my dear students. Once again, a good afternoon to all. I'm extremely happy to address this gathering. The COVID pandemic has thrown before us a number of challenges as all our normal activities have come to standstill, and also nobody is yet certain about when normalcy will return to us. And hence, we are somehow managing our essential requirements of daily life with a lot of regulations and conditions. the existing medical infrastructure, pharmaceuticals, and treatment systems are found insufficient and as ad hoc arrangements in the absence of specific medicines and vaccines. There will be more emphasis on good, ideal food habits, building up health and immunity, and living in harmony with nature. Health professionals, scientists, and nutritional specialists will have a key role to play in the post-COVID scenario, since health, hygiene, food, and nutrition are going to be the thrust areas of consideration. We may remember at these times the sacrifices done by the medical professionals, many of them risking and even losing their lives for the sake of others. I take this opportunity to express our gratefulness to them, honor them, and salute them for their invaluable services and sacrifices. A lot of research and deliberations will take place on these aspects to sustain and improve the health and immunity of the human beings in general at large. New protocols, standards, and practices will have to be followed for everybody to face the challenges of the situations that we are undergoing at present. Food habits and nutrition awareness practices will be the focal areas in the near future, and there will be a lot of interest in these areas by the general public. Today's session by Dr. Jibin Thomas and the following deliberations will be enlightening and awakening to all of us. Dr. Jibin John Thomas, consultant physician and diabetologist, Abir Hospital and Medical Center, Kuwait, is a highly intellectual physician with excellent diagnostic skills, specialized in the diagnosis of treatment of diabetes and the related disorders and diseases. As I was going through his long list of credentials, I realized that he is the most ideal person, highly qualified and experienced in this domain. I am very much delighted to once again welcome you, sir, for today's very valuable awareness session.
Thank you.
At the same time, I congratulate the Department of Clinical Nutrition and Dietetics of the Women's Study Center of this college for their initiative in arranging this international webinar on COVID-19, understanding the real threat to human at this crucial time. In the light of unexpected turn of situations, it is the most relevant and appropriate that the Department of Clinical Nutrition and Dietetics is going to commence a graduate program aside from the ongoing MSc and diploma programs. I congratulate the department and wish my best for the UG program that they are going to initiate this academic year. Let me compliment the efforts taken by the coordinator of Women's Study Center, Associate Professor Srimadi Lekha Srinivasan, and Srimadi Ani Thomas Thornton, the head of the department, assistant lecturers Srimadi Surya Pataram, Srimadi Rajini, and Dr. Priya Pillai, and also the new faculty, Srimadi Sandhya Sajiv, for all their great efforts contributed to this great initiative. My best wishes for a fruitful webinar to all the participants. Thank you all.
Thank you, ma'am. May I invite our Director, Reverend Sister Vinita, to felicitate.
Hello, everyone. Hello, can you hear me?
Yes, sister. Yes, we can hear you, sister.
Good afternoon to one and all. I'm extremely happy that the Department of Clinical Nutrition under Women's Health Studies has organized this awareness section on COVID-19. COVID has changed our way of thinking, the way we live our life. In fact, the environment also has changed much due to the arrival of Corona. As our principal has rightly said, it has placed a challenge for us and humanity has accepted it. Today, we are doing whatever we were not doing. And I hope and pray that it will only be for some time. Once again, we will be able to see one another face to face, hold hands, and bring back normalcy in human life. But accepting the challenges, today we have learned to cope with the situation thanks to the digital world that makes things possible for us to listen to at least to one another. Now, coping with Corona is a task that we have to face. And expert opinion are always good to help us to tide over any difficulty that we face. We read the papers every day, we listen to news, and we get a ray of hope saying that medicine is going to be found or it's on the way, and that actually helps people to boost up their enthusiasm and hope. I would have been happy to see everyone in this platform face to face, but that is not made possible. I congratulate the department for organizing this, and also for all the participants who are here to listen to an expert like speech from our chief speaker of today. May God bless all of us and keep us all safe to witness the changes that takes place after we tide over this pandemic situation. God bless one and all the best to the department and also to all of you who are participating in this session. Thank you very much. Once again, God bless you.
Thank you, sister. Now I invite Dr. Jibin John Thomas, our resource person for the session. Over to you, doctor.
Thank you. Okay, at this very outset, I would like to welcome you all to this webinar session. And St. Teresa's College, its administration, Director Sister Vinitha, Principal Lissy, and the Department of Clinical Nutrition and Dietetics for giving me such a wonderful opportunity to stand virtually in front of this auspicious crowd and to make you aware about the current situations and the current topic of discussion. It's really my privilege to stand in front of this prestigious institution like St. Teresa's and to deliver this topic of today. We know that COVID-19 has been the main news and the main impact in our life now. Since the last 3 to 4 months, we know what we are going through, and it's the same which we are all sharing around the world. We don't know when this pandemic will be over, but we are sure that one day we will come out of this, we shall overcome this together. And there are good signs which are coming out, telling that we probably will have a vaccine in our hand. And also there are new studies and researches happening around the world. I am sure there hasn't been any disease in the world which has been gone through such a tremendous research in a very short span of time. All diseases have gradually emerged in this world, and the researches were very lagging and going on very slowly. But this COVID has changed the entire situation of research. Researches are going on in very full swing. We know that almost 120 vaccines are now currently under studies and trial. And we hope among this 120, at least one will do us good in the coming months. Let me introduce myself, Dr. Jibin. I am presently in Kuwait. I'm a consultant physician and a diabetologist. I'm working with Abir Medical Center, Kuwait. I was previously working with Believers Church Medical College and then I moved on to Kuwait. My family, my wife, Dr. Neetu, she's a psychiatrist. She's in Kerala right now, and I have a 4-year-old son. So without wasting much time, let's go to our topic for today. And let me tell you all, I actually wanted this session to be an interactive section, but virtually an interaction with Zoom will make a lot of trouble, because already I think we have 160 to 170 participants, and if all of you are going to tell together, it's going to be a problem. None of us are going to understand anything. So at the end, I'll be taking questions. Your questions can be shared in the chat box. At the end, I'll be answering all your questions. I know most questions will be about Corona only. And the topic for today, what I'm going to discuss with you is the life cycle, the physiological changes in humans, the normal physiological changes which happens in humans. That's right from pregnancy to infancy, and it carries on till the geriatric age. And we know it's a stage, it's a cycle, it's an evolution-like thing, and it takes many years. And along with that, we are going to discuss the physiological changes COVID is going to make in our lives, in humans, and also the real threat to humans. What is the real threat to humans? We'll be touching on the COVID mechanism, the transmission, the prevention strategies, the treatment in a very minute nutshell. I'm sure you all don't want to get bored by hearing the all treatment aspects of COVID, but a minute nutshell about what's a treatment. And then we'll end with a short summary. I know it's 1 o'clock and 2 o'clock time in India, after a very heavy meal and a very good session of nap will be in front of all of us. And my aim of today's talk is not to make my audience sleep. So I hope it will be an interactive session from my side, and you all will be enlightened in my talk. So we know the stages of growth and development in humans. You can see in my slide, the preterm newborn, the newborn switches on to infant, the infant goes to toddler, the toddler becomes a preschool child, a school child goes to a stage of puberty, and then he becomes a teenager, then middle-aged, and then geriatric group. We all know these stages. And most of us, I'm sure because of the nutrition and the dietetics, the department will be more knowing about the nutritional changes happening in this stage. And many other physiological changes most of us will be aware about. So my aim for today is to identify and define the different stages of human life cycle, and to touch on how the human body develops from infancy through the toddler years, its gradual climb, and to understand what is the relevance of COVID-19 and changes to the human body or infection, the prevention strategies and treatment. I'm sure most of you have seen this famous saying in the American Journal of Clinical Nutrition. It says the human lifespan, or the maximum length of time possible for human life in this world, is 130 years. I'm sure you all will agree with me, because we have been hearing news in between about people living 200 years, 120 years. And does anyone of you know who has lived the most number of years in this world? The oldest person ever to live in Earth for such a long period is Jean Calment. That is 1875 to 1997 in France. She lived about 122 years and 164 days. My God. That's too much for us to believe that someone is living almost double of the expectancy in India. In India, we all know 70 to 80 is the maximum expectancy. Maybe in European countries and US and all, we know people live much longer, and that has made a great change during the COVID time. We know the COVID deaths have been more in US and Europe. The main reason for that is the elderly people. The elderly people are treated very well in Europe and US. I'm sure in India also they have been treated well, but the advantage in Europe and US is that they don't have to spend a penny from their purse to get treated. The government is looking after them. So they live more. They have huge life expectancy. So we can see in France, this is the lady, Jean Calment. She lived for 122 years. So that's a remarkable lifespan. And I hope we all will be able to see the same duration of life. We know the human body changes significantly over time. It's a small time lapse, we know. And food is the fuel. We all fill petrol and diesel in our cars and our vehicles, and it's creeping up every day, the rates we know. But then if we don't have food, the human body will not change. The human body is a system where it needs a food. Food is the fuel. People of all ages need the same basic nutrients. The basic nutrients we know: amino acids, carbohydrates, essential fatty acids, and almost approximately 28 vitamins and minerals. We know about the vitamins and all because the relevance of vitamin D and vitamin C has evolved in this COVID-19. Let me tell you, I was searching in Kuwait, almost all pharmacies around Kuwait, for one of my patients to get one tablet of vitamin D, and it is not available. You know the reason why? The social medias, the news medias, it has been pumping up news of boosting the immunity with vitamin D and vitamin C and this onions and many other things which are there in the nature to boost up immunity during COVID. And people have been stocking up in their house. They have been giving for kids, for geriatric age, and people who have never heard the word of vitamin D are suddenly eating vitamin D, vitamin C, and it's not available anywhere. See, these were things which were needed by us before long. Whenever we were born, from that time, we need all these things. I hope you all agree with me. I hope the nutrition and dietetics people will know more about amino acids, carbohydrate, vitamins, and minerals needed in our life. So these are the stages you can see in my slide. You can see an infant going up, goes to a middle age, the geriatric age. So these are the stages. Starts with pregnancy. We all know. Then only the infancy can happen. Toddler years, childhood, puberty, late adolescence, adulthood, middle age, and senior years. That's the geriatric age. And that's the most neglected age also, I should say, senior age. Let's start with pregnancy. What happens in pregnancy? It's a most holistic thing in our life. A woman getting pregnant is a very holy thing and a holistic thing. The developmental marathon lasts about 40 weeks. It's not something which is happening over 1 or 2 days. 40 weeks it takes for an infant or a newborn to develop in a mother's uterus. And we know there are 3 trimesters: first trimester, second trimester, and third trimester. It's been split equally or evidently, weeks 1 to 12 in the first, 13 to 27 in the second, and it ends with the third trimester, which is the week 28 till birth. That can go up to 40, but mostly will happen at 36, 37, 38 weeks. So we know what happens in fertilization. The lucky guy. The lucky guy is a spermatozoa. The millions of spermatozoa have been released by the men, and one lucky guy gets to interact with an ovum of a female and the zygote forms. So that's the lucky guy. So the same thing is with COVID. Why I put this picture is because COVID is a virus. Virus is existing in nature in a load. Load meaning a quantity. A viral load of COVID means it's a huge quantity of virus. In this virus, only one virus or one minute virion will be able to make you sick. So that's the relevance of the spermatozoa, and the same with the COVID virus. So that's why I put this picture especially. Then we know the nutritional requirements during pregnancy: vitamin A, C, D, B6, B12 mainly. Iron and folic acid and calcium is needed for the child's growth. Absolutely no alcohol during this period. Plenty of fish. We know omega-3 fatty acids have been supplemented now, especially in Kerala. I'm sure the government is doing a very good job by supplementing all these things free in their government primary health centers and in the community health centers. Reduce the amount of caffeine. Definitely you need to reduce the amount of caffeine when you are pregnant. You cannot consume more of coffee and tea, and exercise daily. That's a must for pregnant ladies. Walking is the best. So we slowly move on to infancy. I don't want to bore you by telling all the things you know. Infancy is birth to age 1, we know. As you can see in the slide, a baby is getting up to the age 1. A number of major physiological changes occur during this stage. The trunk of the body grows very fast than the arms, while the head becomes less prominent in comparison to the limbs. The organs, this is the time when the organs in our body, it develops and it increases in size at a rapid rate. Also during this period, countless new synapses form to link the brain neurons. The brain is made up of neurons. Brain has an electrical system, same like our heart. Our heart and brain works with an electrical system, same like the switches in our home. If there is any problem with the electrical, the conduction in heart, it creates a heart block and the heart will come to standstill. Same happens with brain. If the synapses doesn't link The synapses need to link like intertwining neurons. If the synapse doesn't happen, it won't be a proper mechanism in our brain. And that is the time when we get seizures, epilepsy, we know. Many people have these problems. The two soft spots on baby skull, if you don't know, I will enlighten you. Those are called as fontanelles. Those are very, very important in a baby's life. And if you don't know, we should know about it. It helps the skull. The skull is not fully formed at birth. The skull is like this. It has gaps in between and it has to join together. So that happens only after a period of time. That happens because the brain grows in infancy and grows so that it can accommodate the brain in the skull. So this is the posterior and anterior fontanelles. So this gap is there at birth. This should naturally close as the age advances in a baby. So this is basically to accommodate the brain in a baby. The posterior fontanelle, that means the fontanelle at the back, the gap is called as fontanelle. That closes first by the age of 8 weeks. And the anterior fontanelle closes only by a year when the brain is almost grown in size. But then the doctors, when parents bring babies to their OPD, doctors first check these fontanelles. If these fontanelles are closed, it means that the baby is normal and is going through a normal stage of development. If there is any developmental problem with the baby, the doctors will know it by touching on this, the closures. If the closure is not closed by the age, probably they will have to undergo some test. So development milestone we know, sitting up, learning to walk, teething, vocalizing, everything happens. And also the nutrition requirements are plenty during this age. We know it's mainly milk. The birth weight doubles at 6 months and triples by 1 year. Same with the height also, it gradually increases. The main thing happening during infancy, we all should know, is the body water percentage changes from 75 to 60%. We all know that our body has 60% of water. That transition takes place in infancy, and body fat increases. When the baby is born, the body fat is very less. It increases from 12 to 24 in infancy. The main thing in infancy is breastfeeding. And why I put this slide for you is, for all of you, I know I'm sure I'm mainly addressing a crowd of women and the importance of breastfeeding for your kids. That should be the priority. Whatever is there, try to avoid bottle formulas and give your kid breast milk. The importance of breast milk is, it has a lot of antibodies, lactoferrins, it has a lot of immunoglobulins, a lot of natural things from the mother gets transferred to the baby through breast milk. Even vitamins, minerals, iron, lot of things. It helps the baby a lot in his development. Many problems in his future life also will change if enough of breast milk has been drank by the baby. And also there are a lot of fatty acids, DHA, ARA, which are all vital for the brain, vision, all organ growths. Even it's very good for the immunity of the baby. The first milk from the mother is called as colostrum. The colostrum should be given to the baby. The first milk which comes from the mother. We know the stages baby goes through. You can see he jumps, he crawls, he topples, he walks, he builds block, he learns to ride the cycle, he throws a ball. So it's a natural cycle. Then suddenly he jumps into a toddler. Oh my God, it's a very uncontrollable stage. I know, I just passed the stage now. It's very difficult to control babies and kids in this age. About 3 years, 4 years, he learns about his life. He understands what is life. He identifies taste. He sees new things. Everything is curious for him, adventurous for him. He tries to break things. He tries to differently eat things. He tries to imitate us. That's the main thing of all. So parents have to be more careful. You have to be very cautious. Major physiological changes continues these toddler years. Unlike in infancy, the main change is the limb grows very faster. The baby becomes tall very fast in this age. By the end of third year, the toddler is very tall and slender and has an erect posture. The bone density increases because the size of the bones increase and the tissues gradually replaced by cartilage. This process is known as ossification. Ossification is a process in which the bone tissue gradually replaces by cartilage. So the developmental milestone continues: running, drawing, toilet training, self-feeding. The toddler acts to speak, learn, eats, he imitates, he does everything in his life. This is the time when he needs macro and micronutrients. The milk will stay away for a while, but he will be having milk. Though milk, he'll be having micro and macronutrition. He learns to self-handle food. He wants to eat food on his own. That is at this age. They don't want to be given food. They try to eat food. This is the time parents have to be very careful. Avoid high-risk chalky foods. Foods very small in size, very small nuts, etc. you should avoid, because there is a chance of choking, and choking is very dangerous in kids, so you should avoid it. This age, iron deficiency, anemia, and diarrhea is very frequent. So you should supplement things in which your babies will get iron, and also prevent more food from outside, because diarrhea will be very frequent at this age. The child is only getting his adaptive immunity slowly. The nail biting is one of the most seen behavior at this age. Then he runs into school. That's again goes into a spurt of uncontrolled behavior. He learns new things from his friends. He tells new words which have been spoken in our family. He will be introducing those words in our family. I'm sure all of you will be knowing about that. That's a 4 to 8 years. Child's limb lengthens steadily. The growth of the other body parts begins to slow down. The skull and the brain have grown to near adult size. That is by this age. Emotional and psychological changes, that happens at this age. This is the age in which the emotions and the psychological changes start to develop. And they start to know more about food from their family members, also from their relatives, their social surrounding. They try to understand everything. So all of these factors should impact the nutritional choices. The parents should make sure that you give your children a very nutritional diet at this age, because this is the age your child is going to learn. He starts to understand everything. So you have to try giving new kinds of food at this time, because they will learn and they will keep this in their entire lifetime. And if you only supplement one kind of food and pre-packed food and preserved food, they will only eat this all throughout their life. You have to give them different kinds of foods which have micro, macro, vitamins, minerals, fibers, calcium, everything. The parents should serve as a role model. I told about this before. They should not drink or smoke in front of their kids. This they try to imitate. And even if they don't learn to imitate, this will be an encouraging factor for them. They will think that their parents are doing this and I should also do this. So it's not a right thing to do in front of children. Next, we jump into puberty. We all know about puberty. It's the beginning of adolescence. It's a bridge between childhood and young adulthood. This is defined as a period between ages 11 and 14 in girls and between 12 and 15 in boys. So the different pubertical changes we know, the sex characteristics change, the reproductive organs start to grow and it advances. Main things in females is menstruation, and secondary sexual characters start growing in both men and women. The facial hair in men and etc. Deepening of voice in boys, etc. So these are the changes I have just put in a slide. You can see what all the changes happening during puberty. All stages we are aware of. Next, we jump into late adolescence. It's the age of 14 to 18. It's the age of trying out new things. They are going out into the community. The rate of physical growth slows down. The girls stop growing taller around age 16, while boys continue to grow taller until ages 18 to 20. So boys continue to grow till 20, but girls stop between 16 and 17, they stop. The physiological and emotional changes that take place during this life stage includes the desire of independence. They want to be independent at this age. They want to go everywhere alone. They want to learn new things. They don't want to be dependent under their parents. This is the age which they develop independence and they want to be apart from their family, and jumps into young adulthood. That is 19 to 30 years, the age when they start working, they start meeting new friends, new relations start growing. It's a stable time. A stable time is young adulthood compared to childhood and adolescence. The physical growth has been completely been done. The organs and the body systems are fully developed by 30 years. Typically, a young adult who is active has reached his physical peak. This is we call the peak of health and the prime of health. That is age 30. That's the age where we have attained the peak and the prime of our health in our lifetime. That is 30 years. For example, vital capacity. I would like to tell you what is vital capacity. The maximum amount of air the lungs can inhale and exhale. That's in between this age, 20 to 40, or maybe 30, 35. After that, it gradually slows down and different kind of changes happen. The proper nutrition and physical activity is needed at this age, proper exercise, which promote wellness, and it builds a solid foundation as he grows into a geriatric age group. Next, they jump into middle age, that is 30 to 60. They get married. The main changes happening in this stages are early of this period is totally different from the end. I mean, at the 30 years, it's a stage in which there are some changes, but at the end, it's about a different scenario. I'll explain to you. Early years, middle-aged women experience pregnancy, childhood, and breastfeeding, that is lactation. But in the later part of this life, women face perimenopause. They attain menopause, and which is this transition period that leads to their hormonal changes and other kind of changes in their body. So it's quite different. The early phase of this stage is totally different from the late stage. The bone starts to lose its adequate density as women has changes in their hormones and calcium. Both men and women will have eye problems, visual acuity. Some diseases start now because it's an age where people are growing up, and presbyopia and visual acuity are some problems which the elderly get, the shortness of sight or the farness of sight, etc. So this is at that age. The signs of aging starts. Human body begins to change in very subtle and non-subtle ways. Proper diet and adequate exercise also needed at this stage. Then we come to the ultimate stage, a period of gracious aging, that's geriatric age, above 60 years. The most neglected stage, I should say, in many parts of the world. But Europe, as I said before, Europe, America, etc., they treat their elderly people very good. They have better health. They have better healthcare facilities. They are offered more kind of treatments, and they are looked after very well. I think a culture should develop even in India and other parts of the world where the pediatric age group is seen as a very, very, very subtle age and a age which is similar to as infancy, because that's a period when they need more help. Both men and women experience loss of muscle mass at this stage, and in men especially estrogen and testosterone levels begin to decline, and men experience many problems at this age. The nervous system has many changes. Dementia starts, memory loss. Many problems develop between memory and understanding, etc., during this period. So these are the stages what I wanted to tell you and brush up with you. The normal physiological changes we go through from pregnancy to geriatric age. I'm sure you all might have understood what I have spoken. Even if at least one line of what I said you understood, that's the best, because what we are going into is an ocean. The ocean is COVID-19. So we have to be more careful. The take-home message before we start COVID is physiological changes happen throughout the life. Nutrition at all stages is extremely important. The nutritional needs changes and quantity differs as we go through stages. Diseases are avoidable, but some are unavoidable. They creep in very fast. Inheritable diseases like diabetes and hypertension start to come. We have to make sure our body is as happy as our mind, because physical completeness and mental health both are important. They should tide and go together. Then only our system, our body will work well. Remember, what we eat may affect not just our physical health, but also our mental health. So our food should be very wisely taken. You should be choosy when you choose your foods, and you cannot eat everything which is available in the nature. You have to be very choosy for your well-being and your life. This was the topic, or is the topic I'm sure you all will be looking into, the hot topic of the day. Every day we are hearing news about coronavirus and COVID-19. And let me tell you, I don't know how many number of talks and sessions I have taken for the past 3 to 4 months. It's all about COVID and coronavirus. And I've been telling people not to see your social medias and your news throughout the day. Right from when you get up, you will check what's the death toll, what's the recovery, and even before you sleep, you check what's the death toll. It's really unfortunate, let me say, because it really affects our mental health too. It's good to see news, but maybe once in a day or twice in a day. And the same thing with the social networks as well. So what is COVID-19? We all know that COVID-19 is a virus. Last day, I happened to get a WhatsApp message telling that Corona is not a virus, it's a bacteria. I'm sure most of you among this group will also might have received that WhatsApp message. A totally fake and made up message, which some man or women translated from Kenyan website. It was mainly the message came in English. It was translated into Malayalam and it was circulated around the world that COVID is not a virus, it's a bacteria. Let me tell you, Corona is a virus. All countries have its genetic makeup. The vaccines are under study. So stop believing this social messages coming. Make sure the messages are legit and then only you move forward. So what changes happen during coronavirus? We know that coronavirus particularly affects our lungs and heart. And we have been hearing of pneumonia and heart attacks a lot during this period. So we have to know why the lungs and heart are targeted. Why not our eyes? Why not our brains? All systems in our body are being affected due to corona. But why mainly lungs and heart? Let me tell you, you should know what is ACE2. You can see in my slide. It's angiotensin converting enzyme 2. This is found in all of our bodies. Mainly, it is abundantly seen in our lungs and heart. You mark my word, abundantly seen. It's also seen in the gut. It's also seen in the many parts of our body, but it's abundantly seen in lungs and heart. And this protein sits on the surface of these organs, and it is like a gate for this coronavirus to come and attach. Coronavirus structure we know. It's a ball-shaped structure. It has a spike protein on top that is like thorns. And this thorns has an affinity towards ACE2. It comes and binds with the ACE2 and it gets attached to the body. That is why the main toll which your body takes is the lungs and the heart. More of coronavirus get trapped in the lungs and heart, creating a lot of damage. And we know how this coronavirus transmits. Coronavirus transmits when we get these viral particles or droplets from another infective individual. This infective individual has to be near you. If the infective individual is at the end of your room, the other side of your room, it's very minute chance that you will get corona. He should be near you, less than 1 meter near you, and he should be sneezing or coughing right in front of you so that you get a lot of virus from his body. And this particle should enter your body and should create a problem inside your body. So it's a very pretty difficult thing when you think. But if you don't take any precautions and stand in front of an infected individual for 10 to 15 minutes, you will definitely get infected. But if the time span is very less, you are standing in front of an infective individual for 1 minute and he is wearing a mask and you are also wearing a mask properly, and you are adhering to all restrictions and precautions of COVID, there is a very, very, very minute chance that you will get corona. Maybe less than 5% or maybe even lesser than that. But if you are not following any precautions and you are with an individual who is infected and you're spending more time with him and he is straightly sneezing and coughing on your face, that time you will get the infection. So that is how it spreads. Also, we know about surface spread of coronavirus. These viral droplets fall on the surfaces and we touch on the surfaces and we touch on our face, nose, eyes, mouth, etc. That's an easy way to get transmission. And one virion, that's a million of virion should be there to infect you. One virion, if it comes to your body, it's like nothing. The same example I've been telling before about spermatozoa, it's like nothing. Only if a million kind of guys come into you, only you will be infected. So that is what happens with asymptomatic infection and symptomatic infection. Why many people are asymptomatic? Why many patients with corona are asymptomatic? That's because they get very least amount of viral load, maybe 100, maybe 150, maybe even lesser than that. So their infection just goes off like that. Various minute fever they may get a small headache and it passes off. But a person who has got millions of virions into his body directly will be affected very badly. It doesn't matter what age he is. It matters the age if it's a very geriatric age and he's having a lot of diseases. But it doesn't matter what age. It depends on the distance. It depends on the precautions you do. It depends on the load, the viral load. So what is viral load? All viruses have viral load. You can see in my slide, the first test tube shows the amount of viral load. Those are the viruses staying in the test tubes. And the no viral load in the second test tube, you can see just 2 of them. So the scenario is like if you get only plenty of virions, you will be infected with corona. Just 2 of the virions, very minute possibility that you will get corona. And you should be adhering to all precautions by our government so that you won't even get infected with these 2 virions. So we know ACE2, I have been telling you, it's a key biochemical pathway which regulates your blood pressure. A lot of people who are eating blood pressure medications are eating medications for ACE2. So there was a study currently that people who are eating this hypertension or blood pressure medication are more prone to coronavirus. But that studies have been revamped because it's been proven or it's been sludged off that it's not possible and people can continue taking hypertensive tablets. But this ACE2, it acts as a gateway for this virus to enter our body. It hijacks the cells, the protein making machinery, it copies itself. Virus is the only organism which can multiply in our body. It makes several photocopies of itself. It starts replicating. One virus goes into 10, 10 goes into 20, 30, 40, 50, but that virus should be infective. If it's not infective, the multiplication wouldn't happen as such. So what is myocarditis? Same like pneumonia. I told you about lungs getting pneumonia. Pneumonia is a condition in which your lungs become inflamed. It contains a lot of mucus and mucus gets trapped in between the alveoli of your lungs and the oxygenation becomes really impossible, leading to breathlessness. Same happens with the heart, myocarditis. Myocarditis is the inflammation of the heart. That's a situation in which your heart won't be able to pump blood like before. All viral infections have a possibility to cause myocarditis. But then why coronavirus? Because coronavirus enters through ACE2. ACE2 is present on your heart muscle, that's a myocardium. And when your myocardium becomes inflamed, some people recover after the infection. Some people won't be able to recover because they have previously some kind of problems or their body is not that adaptive or immune to infections. So that's a possibility of myocarditis and pneumonia happening in coronavirus. And smokers. Smokers have to be careful because people who smoke have a problem with their lungs. They take in all the carbon dioxide and their alveoli have been damaged from years. These people who get COVID have a lot of chance to go into a very disastrous state, go into pneumonia, go into septicemia, and maybe it can be a mortality. So scientists from around the world have been warning smokers to stop smoking or to keep precautions so that you won't get COVID because it's going to be a danger, smoking and corona. So once another study was done to see in smokers, how does this ACE2 spike happen? But that study also got washed away because nothing was able to be proven with this study. And the studies are scaling up at a very high rate. And we need more studies to confirm if the ACE2 is the real target for COVID virus. As you can see in my picture, there are certain things in our body called as leukocytes and cytokines. They help our body. You see, this is a skin. A skin has got a wound and the bacteria has come in through the wound. So for helping the body, cytokines, leukocytes, everything rush to the site to kill this bacteria and to promote the healing mechanism. But then the cytokines, we should know what it does to our body. Cytokines are very soluble proteins. They are produced only when an infection is triggered in your body and an antigen arises. They function as chemical messengers. They regulate our innate and adaptive immune system. So cytokines are a major part of our immune system. We have heard about boosting of our immune system during COVID virus. And a lot of people have been eating vitamins and minerals, as I said before, for preventing corona. But let me tell you very frankly, for boosting up your immunity, you can eat vitamin D, vitamin C, onions, anything can be eaten. But suddenly boosting your immunity is impossible. And again, preventing coronavirus by boosting your immunity is also quite impossible. Things which you should do and which you have in your hand must be done by you. Because if you don't do such kind of things and depend on your boosting of your immunity, and you eat this onions and vitamin D and vitamin C and think that the coronavirus won't come to us, it's going to be very difficult. You have to follow the precautions and guidelines by your government. You have to wear a mask, and you should know how not to wear a mask. That's the most important thing. Touching on your mask, removing your mask and keeping it on the table. Let me tell you, in Kuwait, I have personally seen myself, other people who are driving car, when they go to office, when they get out from their home, they wear the mask. As soon as they enter the car, they remove the mask and hang it on the rear view mirror inside their car. And they go to the office. On reaching office, they put back the mask, they go to the office. Coming back also, they do the same thing. They get into the car, they hang it on the rear view mirror or keep it in the dashboard. What is the use of mask? Why is a mask created? And I have been seeing politicians all around the world hanging the mask on their mandibles. What's the use of the mask on your mandible? Is it created to support your mandible? Your mandible, God has provided you a right kind of mechanism to be on your face by itself. Why do you need a support? And why are you wearing? What are you trying to do? Are you trying to justify the situation? Or are you trying to show that you are using a mask and to be away from any social media scare? That's not the thing. Our health is the priority. We have to take care of our health. Mask has to be above your nose and your mouth. And it has to be sealed in a very, very good way that no air goes out. When you wear a mask, you should check through which way air is going out. If it's a surgical mask, it's very difficult to be more tight. If it's an N95 mask, it's very, very, very protective, and it's very hard on your face, and it protects you from even the minute microns. So cytokines we are talking about, they are needed for your immune system, and a broad range of cells produce the cytokines. We know there are a lot of cells in our body. Macrophages, B lymphocytes, T lymphocytes, mast cells, endothelial cells, fibroblasts. A lot of cells are there in our body which help in the healing and the immunity. These cytokines, they help in fighting these infections. We all have cytokines in our body. And let me tell you, immune system over-triggering during an infection is another reason for death in COVID patient. You have your immune system at its peak, and your cells like cytokines and other cells which are helping you to fight the infection are produced abundantly during this COVID virus. When it's produced very abundantly, it creates inflammation, it creates problematic situation in your lungs, your myocardium, your blood vessels, and it's a big stressor for your body. Let me tell you, I have treated personally many patients who are hepatitis positive and HIV positive, who have died of this immune system over triggering, or what we call as cytokine storm. Let me tell you what is a cytokine storm. You can see this is your lungs. This is the alveoli and the bronchioles and the system. You have two lungs and it branches into alveolus and bronchioles. Cytokines are proteins which are generated during an infection. Cytokines consist of this interleukin factors, IFN, etc., etc. You don't need to know much about it. But then when there is a lot of cytokines in your body, that is what we call as cytokine storm. When the cytokine storm happens, there is a big stress for the body, and doctors are not able to treat cytokine storm. There is very, very less treatment for cytokine storm. The treatment availables are, as I can tell you, steroids, antibiotics, supportive therapy, and immunoglobulins. But many cases we won't be able to rescue people with cytokine storm, because cytokine storm is something which is not in our hands. Our body has to stop producing cytokines. What we can do is try to give steroids and supportive therapy and immunoglobulins to stop the inflammation. But corona patients, this is a main problem. Cytokine storm triggers death in an individual who has a very good immune system. And that is the reason why children are not affected mainly during coronavirus. Let me tell you, children have an immunity. They have an innate immunity and also an adaptive immunity. We all have that. Children are developing immunity only as the age advances. Why children are less affected in corona? We see very less death among children. The mortality and the morbidity happens with adulthood and the elderly people more. That's because the immunity is not at the peak, and the cytokine storm is very less happening in children. So children are safe. They may get the immunity and they may pass it on. And that's why the difference between the age happens in coronavirus. I'm sure you all would have understood what is cytokine storm. What I was trying to say is boosting your immunity is always good, but boosting your immunity is not enough to protect you from COVID. COVID is a threat, and you should follow the guidelines. Mask, social distancing of 2 meters, and also the other things told by the government officials. If you don't follow these things and you don't wash your hands, you don't use a sanitizer and soap, it's going to be difficult. So how can we stop this pandemic? We all know we have to test, trace, treat, and isolate. This is the only way we can get out of COVID. You have to do more tests, you have to trace people, you have to treat people, and you have to isolate people. It's everywhere. The news channel, the social medias is full of COVID virus. I am going to show you an illustrative guideline by our Ministry of Family, Health and Welfare. They have put a behavioral approximate guideline on how to change your behavior according to COVID. So you can see you have to wear a mask when you're in the public. Set of 15 promises we need to follow as part of COVID. You have to greet without physical contact, maintain physical distance. Same time, maintaining physical distance, you have to have a mental nearness to support your friends and relatives. Wear a mask, do not chew tobacco, do not spit on the ground, avoid unnecessary travels, discourage crowd, do not promote anything which is false in the social media, and seek psychosocial help. Greet without physical contact. You have to be responsible. You can show different signs of greeting. You can say namaste. You can show thumbs up of greeting without shaking hands. You have to maintain physical distance of 6 feet or 2 meters at least. Follow all distancing norms wherever we are. Now we know the lockdowns are going to be eased up. Everything is going to open up. Airports are going to open up. First wave of corona is over and second wave is already happening in India because a lot of people have been traveling from outside. We don't want a third wave. We have to end this with the second wave. So maintain all these things. Especially when you go out for shopping, you have to make a physical distance. You have to use your mask, your gloves, your etc. When you use your gloves for shopping, let me tell you, gloves is not at all encouraged during shopping. If you use your glove, you have to be careful not to touch the products in the supermarket and then touch your mobiles, touch your pockets, touch your purse, touch your pens, touch your car keys. If you start using gloves and you start shopping, you should shop, finish, and go to the counter, put your items, throw away the gloves, sanitize your hand, pay, and then only you can touch your body or your face. If you start touching your mobiles and your purse with the gloves you're using to shop, it's going to be a disaster. Do not use your mobiles or your purse or anything with the gloves you use for shopping. Wear a reusable mask, which is very easy for everyone. And why is it necessary to wear a handmade or face cover? Because it's very easy. You can make it in your home. You can do many things to protect the viral droplets coming out from your nose if you're infective, or even if you're not infective, there are a set of guidelines which you should follow. You have to use a handkerchief or a tissue while you sneeze or cough in the public. If you don't have these both, you have to use your elbow or your hands and prevent from all these viral droplets going out. So do I need to wear a mask at all times? When should I wear a mask? If I am alone in a car, should I wear a mask? These all are doubts in between you. And we know there are a lot of facts and myths during Corona. We know what happened in America. American's president itself told you can start drinking chlorine and antiseptic products. And many people did that. That was very frightening. Many people came to the casualty drinking Domex and chlorine. And there are a lot of myths around, like COVID is just a flu, everyone with COVID dies, face mask always protect against coronavirus, hand dryers kill coronavirus, and it's a mutated form of influenza virus. Those all are myths. Nothing has been confirmed. We have to know that we have to wash our hands with soap and sanitizer. Soap is the best. Why do we say soap is the best? Anyone knows why soap is the best? How does soap kill coronavirus? Does any one of us know? We are all following this. So how does soap help? This is how soap helps. You can see the coronavirus, the spike protein, and the other side what we see is the soap, the hydrophilic head and the hydrophobic tail. The soap molecules enter the coronavirus through the spike protein. It enters the cell and it damages the virus and it breaks it. It breaks apart so that the virus goes dead as soon as you apply soap to your hand. That is why we tell you always wash your hands with soap. The same thing happens with alcohol. But many people have asked me, doctor, why only 70% alcohol? Can I start drinking alcohol to prevent COVID? Many people have been asking me this. See, alcohol is good. I'm applying on my hands and virus is dying. Why cannot I drink it? I drink alcohol all day and I prevent myself from getting COVID. And why 70%? Let me tell you, 70% of alcohol is a stable form which stays on your hand for some time before evaporation. If it's an 80%, 90% or 100% alcohol, as soon as it comes out to the environment, it evaporates. So there won't be any big effect on the hands when you're applying it. And why not drink it? Drinking alcohol percentage is very less, 40, 30, 20, 15. It's more mixed with water and it does nothing to your body other than creates damage to your liver, and it absorbed by your gut, but it's not a treatment. You cannot drink alcohol. You shouldn't drink alcohol to prevent getting corona. You should continue using soap and sanitizer. I'm sure you would have understood why soap and why 70% alcohol. Avoid touching your eyes, nose or mouth. Your hands touch many surfaces. Let me frankly tell you, there has no studies yet in the world which proved that coronavirus gets transmitted from surfaces. From your hand, from your doorknobs, from your car, from your tables. There are no scientific proven studies, but we believe the droplets from your mouth and your nose fall on these places, and we don't know the duration. Many things have come out telling duration on metal is 7 hours, duration on wood is 24 hours. That's not a confirmatory study. We know the virus can stay, but we should know how it evolves. Only as the year advances, we'll be able to know about that. But you have to be careful. You have to disinfect your daily touching places like your doorknobs, your bell at your home, your car handles, your table of work, even at office and at home, and also public places where you imagine to touch. Let me tell you, if you are using a lift, try to use the lift with a tissue paper or a throwaway paper. Using the paper only, you touch the button of the lift and you throw away the paper after touching the button, and then clean your hands with a sanitizer or wash your hands. So that's the best way you can do. Rather wearing a gloves from home and carrying all the dirt and particles wherever you're going, it's going to be very difficult. So gloves is not the answer. People think that if you wear a mask and put gloves, you won't get corona. I myself have seen many people walking with a mask under their nose and a gloves to every place and thinking that I won't get corona. People who are going for exercise even are wearing gloves and mask under their nose. Why? Why should you wear a gloves when you're going for exercise? People don't know. Even educated people are wearing this. gloves and mask to prevent corona. They think that's a solution. You have to think wisely, intelligently, and do things in a proper manner. Gloves are only for specific purposes. If you are going for shopping, well, you wear the gloves, but you only touch the products you are buying. Throw away the gloves and sanitize your hands. Do not wear the mask under your nose. You have to keep it on top of your nose and keep it well adjusted to your face. So those are the things we shouldn't forget. You have to maintain a respiratory hygiene. I told you, you have to use your elbows and your hands to prevent sneezing and coughing in public. And wash your hands regularly, disinfect your surfaces, clean your environment, throw away all the waste in your home in a properly closed waste bin. Clean your doorknobs, especially the front door, always, because you don't know who all are touching it. Wipe your tables well. Keep it clean. There is no harm in keeping it clean, even though we don't know what's the genuinity of spreading from surfaces. Use chemical disinfectants. Clean your toilet. If you are people going to different places of work, try to clean your toilets in a frequent interval time with chemicals which can kill and antiseptics. Do not spit in open. This is a main problem in India and many places, especially in North India. Do not spit. I'm hearing that many people are not yet following the guidelines by the government in India. Please be careful, avoid the problems, avoid unnecessary travels, discourage crowds, try meeting your friends and relatives and keeping the social network and relations through virtual media. Virtual media is playing a very big role. You can do that now. Even though you're maintaining a physical social distancing, please keep a mental nearness so that many people won't fall into a lot of mental problems during this lockdown and COVID. Do not circulate any fake things. Discuss your problems with a doctor or anyone who can counsel you or your parents. And psychosocial support with distress and anxiety, you can call a support facility. It's there all around the world now, and you can get treated. Now let's go into the urban and rural India. What's happening in the urban and rural India? I had an opportunity to attend one of an epidemiological webinar last week done by none other than our famous epidemiologist in India, Dr. Jayaprakash from CMC Vellore. And he was addressing us, he was telling us, ICMR, or that's the authority in India to give guidelines and everything about vaccines and all. They did a study. And let me tell you, if you haven't heard of that study, ICMR already went into rural India and that did test in about 40 to 50 lakh of people. And you know what they found out? They found out that almost 90% of the rural India already have COVID and they don't have much symptoms. So that was very striking. Rural India, many people already have COVID and they don't have any symptoms. While urban area also has COVID. But then why rural India are not showing much symptoms? So that's a thing to ponder on. And we don't know what the cause is. Maybe rural India has more immunity because they get with the environment and they do all kind of things. And urban area has a fast life, a very big social life, and the lifestyle is changed in urban India. Maybe the changes happening that made this thing. But this is the thing which we happen to hear during that session. But we don't know what the real reason behind this is. Rural India may have become immune to all these things, or they may have got coronavirus even before time. But this is a thing to ponder on, and this will be a thing I'll be more interested to know in the coming days. So what's the treatment? We know this drug has been released in India, Favipiravir 200 milligrams. It's available in India now for buying. The cost of treatment is almost 3,500 rupees, the total dosage. 14 days treatment it is. First day is 1,800 milligram dosage and followed by 800 milligram for a 14 days. But this is not a full treatment for corona. But what you can do is you can prevent yourself from going into a severe phase of corona, and you can escape from all the symptoms and the problems of oxygen, the decreasing oxygen stages, and going to hospital all can be prevented. That's what the studies of Favipiravir said. The other medicines which are now been approved in India are dexamethasone, remdesivir, plasma convalescent therapy. Let me give you a nutshell about plasma convalescent therapy. Plasma convalescent therapy is a therapy done when an infected individual gives his blood From that blood, plasma is taken, the yellow part is taken. In that plasma, there are antibodies against COVID, and this plasma is given to an individual who has been affected by corona so that he recovers from it. So Covaxin, this is the latest thing. This came out today morning. I'm sure all of you would have seen this. India is coming out with its first indigenous COVID-19 vaccine developed by Bharat Biotech. And we know that it's going to come out by August 15th, 2020. To my surprise, I don't know how they will get it out by August 15th. But what I can tell you is it's a killed vaccine. There are many kind of vaccines in the world. Live attenuated vaccine, killed vaccine. It's a killed vaccine, means the virus is dead and it's given to you and it will trigger an immunity in you and you will be protected against corona. That's what a killed vaccine means. How the trials will go, the government and the Bharat Biotech is telling they're going to fast track the process. Almost 10 to 11 states are going to participate in the trial. July, this week, it's going to start the trial, and August 15th, it seems if everything goes out right, this vaccine will come out and it will be given to the public. If you ask me, is there any risk of taking this vaccine? I would say I cannot completely agree with this August 15th, because I would suggest is let it take a little more time and let's see what side effect this vaccines will bring. But as this is a killed vaccine, the virus is dead and the virus cannot multiply in your body. That's the truth. And the virus cannot do anything to your body. It's a killed vaccine. But the thing to be made sure by the people who make the vaccine is that this virus is properly killed and it's not active. It's fully destroyed and it's fully inactivated. If it's fully inactivated, it's very safe. We all will be able to use it. And our future, what's our future going to be? Travel, tourism, religious places, functions, everything is going to change. This is not the first and last pandemic. We had a pandemic in 1812. We have another pandemic in 1912. And now we are having another big pandemic. We know we take the history of pandemics. You can see the big pandemics and the viruses in the picture I have provided. Look at COVID-19. COVID-19 is in the front and it's very small. The other pandemics have been huge. Plague killed like 75 to 200 million people. And then again, cholera outbreak, it killed almost more than 1 million people. And now COVID will come up to the cholera stage. And HIV AIDS also killed many people. Even SARS-CoV-1, an infection in 2003 killed a few little of people. COVID is also coming to the situation where we are having more deaths now, but we have only 5 lakh of deaths, thankfully. And then we are very glad that the recoveries are more like 50 lakhs and above. We actually want to think in the good sense that this pandemic will get over as soon as possible. And I'm sure we will be able to recover from this. Together, we will definitely fight COVID, but you have to maintain all precautions by the government, wear mask in the proper way, wash your hands, maintain your social distance. So thank you everyone for listening to me. I hope I was able to cover all the topics and I wouldn't have bored you up. Now it's a session open for questions and you can pop in all the questions you want to ask me. Thank you.
Thank you, Doctor, for taking us through the beautiful journey of human development and enlightening us with the topic. As Doctor said, the session is open for discussion.
Sir?
Yeah.
Hello. Can we ask the questions directly or shall I put it in chat box?
Anything is okay. You can ask me directly. That's, I think, more easier now.
Okay.
Yeah.
Okay. Thank you so much, sir. It was a wonderful session. It was actually a right time, the webinar, and it was a very useful information how to use the mask and what to do with all these things. Sir, I have a small doubt.
Please. Yeah.
Yes, sir. We have smokers. We were talking about smokers and the risk of smokers being, susceptible to this COVID-19.
Mm-hmm.
Okay, so it was like, what will happen to person if they have been continuously smoking for 15 years, and right now for COVID situation they have left it, and the sudden leaving of these smoking habit again, will it be a positive or a negative towards COVID-19? Sir?
Okay, thank you for that question. Would you introduce yourself? Maybe everyone who are asking questions.
Okay, sorry, sir. Sorry. This is Yuvarani. Actually, I'm an assistant professor from St. Joseph's College of Engineering, Chennai, sir.
All right. Okay. Thank you. So smoking, we know it's a big problem. It's not a problem with a person alone. It's a social issue. Stopping smoking all of a sudden during this COVID pandemic situation is going to create a lot of problem, because a smoker is not able to stop smoking very fast, and it's going to create a lot of psychiatric and psychological problems in them during this COVID situation. COVID itself is a psychological problem, but then if it happens during this COVID situation, it's going to create a more of a mental stress. So stopping, if it's possible, they can stop, but stopping all of a sudden is not going to reverse this lung problem they are having. The lung parenchyma meaning the organs change continuously. Smokers get all the smoke into their lungs, and all their alveoli are going to get infected and going to get destroyed. It's going to change the texture. Stopping all of a sudden by 1 day or 2 days is not going to change much with their lungs. Their lungs are still prone to infection, but the best thing they can do is reduce the amount of smoking. I'm sure they won't be able to stop smoking in full. All they have to abide by all the precautions and guidelines by the government. Use a mask. It's very difficult to quit smoking, especially during this pandemic situation, but slowly stop the number of cigarettes and follow all the guidelines, and you can seek a help from a psychiatrist or a psychologist if needed. Thank you.
Okay, thank you, sir. Thank you so much for your answer, sir. Thank you.
Doctor, there is one more question.
Yeah.
Participant has asked, what is the role of cytokinin in childhood immunity?
Yeah. Cytokines are needed for all kind of life stages. Even children have cytokines. But the immunity gets developed. See, it's the same like this. One infection when we get, our body has a memory. There are memory cells in our body. It gets registered in the memory cells, and the next time you get the same infection, these memory cells are the ones who are going to act. So in case of children, let me tell you, they haven't gone through all these sort of infections. Their childhood is like getting fever, and they're slowly adapting to each infections. How much ever infections you get exposed to, that much immunity you get. And that's why in children, cytokines are very important for children as well. It's present in children also. The amount of cytokines produced in children may be very comparatively less compared to elderly. That's why this thing is happening. Thank you.
Doctor, there is another question. Does packed and processed food contains coronavirus?
It's a very interesting subject and very interesting question. None of the food products have been tested or studied to have or to carry coronavirus. Maybe coronavirus droplets will be there on top of this processed foods or packets, maybe. But then we don't know actually the possible transmission from this surface to humans. What we know now is a person-to-person transmission is the only thing happening at present. But we are still keeping a double eye on pieces and etc. But spreading from surface inside the food or the food won't contain coronavirus. And it's not good to follow any social media message of that sort. So keep avoiding that. Processed food won't contain. It's better not to eat processed food first of all. So don't even think about eating processed food. Thank you.
Another question, actually, I would like to. Someone has asked in the chat box. Infants who are not expected to wear a mask, and in case of emergency, if they have to leave home, what are the precautions to be taken?
I know it's pretty difficult even for adults to wear this mask for a longer time. If you wear, see, let me tell my experience with the mask. We start wearing our PPE kits, mask, a cover over our hair or our shoes for almost 8 to 12 hours a day. It's very difficult. When we start wearing it, we are not able to remove it until the end of the day. If you remove it, it's a burden on the cost of the healthcare. They have to provide all new things. It's a cost burden. So when it's very difficult for adults, I can and I'm able to tell how much difficult it is for children, especially for very small children. Let me tell you, less than 1 year or maybe even less than 2 years. If they're not following the guidelines of wearing mask and it's not able for them to put the mask, you can do something like when you're going to the public or in between public, at least try to cover the nose and mouth of the kid for a while when you are among the public. It's best not to take kids into public, or even if you're going to a mall or shopping places, it's best not to take very small kids like below the age of 5 at this present time. And if you are taking kids, and especially kids below 1 year, mask is not a very good solution in for smaller kids. Try to do it with a cloth, a 2-fold or 3-folded cloth. Put it over the nose and the face, and you can try removing it and putting it back again and again when you are in the public. Soon after you are away from the public, you can remove it from their nose. There is no problem. But kids who have attained the age of knowledge and understanding, they should definitely wear this mask. This problem is going to arise as soon as the schools are going to open. LKG, UKG, all those school ages. It's going to be difficult. Schooling is going to be pretty difficult for the next few years. Thank you for that question.
Doctor, what is your opinion about hot water steaming in killing the virus?
Let me tell you my wonderful experience with hot water steaming. I had a patient last week. You know what happened? He came to me in WhatsApp telling, "Doctor, look at my tongue." I asked him what happened. He comes to my church. So I asked what happened. He's telling me, "Doctor, I have boils and ulcers on the sides of my tongue. I don't know what happened." So I asked him, what happened really? Do you have any memory of doing anything? Or have you bitten your tongue? Or have you eaten any spicy food? Any food from outside? Or any stresses? Then his story comes up. You know what really happened? 20 days back, he had symptoms of corona. 20 days back. And he recovered by his self-medication because his wife was a nurse and she told him to eat azithromycin and that tablet and this tablet, and all sort of pharmaceutical tablets have been eaten by him by the scare of corona. And then what happened? He saw in WhatsApp that drinking hot water cures corona. He used to boil hot water and he used to drink it. His throat got inflamed. His tongue got burned. So that was a burn. And I told him, why are you doing such kind of things? Who told you that water will kill corona and hot water will throw away corona from your throat? It's a foolish thing to believe that. And believe me, it is an educated man. And I told him what you can do now is you have to wait for your body to heal the boils on your tongue and your throat. You eat curd and you eat egg white. That helps in healing more. Do not drink very boiling hot water to kill corona. Corona is not scared by water. And don't do any sort of things. You ask a legitimate person and only do things which are legit and which are right in this situation. See, the main problem is people are more scared. If they are scared of getting corona and dying of corona, so they are trying to do everything and imitating everything they see every day in WhatsApp, Facebook, and other social media. Thank you for that question. I wanted to tell this thing otherwise also. Thank you.
Doctor, is it fine to use soaps which are kept in the public places?
Yeah, definitely it's safe. You can use any soap or any sanitizers kept in public. There is no problem. Corona doesn't survive on soaps.
We actually have a lot of questions, Doctor. Another question that was put forward is it okay to steam, yeah, to inhale steam or to take once they've gone out and they've come back, is it okay? It's probably a little different from drinking hot water. Is it okay to take a steam?
It's okay to take a steam. Taking steam is not a cure for corona or preventing corona. Taking steam is very good for sinusitis. It drains all the, there is a disease called as sinusitis, and the sinuses are there on the forehead and on the face. If you take steam, the sinuses get drained away fast, but eventually taking steam, a lot of steam into your lungs is not going to do any good or any harm. So don't think that steam will prevent corona or steam will treat corona. Steam is not a solution for any breathing difficulty, because steam is vapor and it is like, smoke, a very small minute particle of smoke. It increases breathing trouble. So whoever is having breathing difficulty, we don't advise to do steam. If you have sinusitis, you can take steam. For breathing difficulty, nebulization with appropriate medication and with saline is the best. So this is the answer about steam. Thank you.
Another question, the Ayush Ministry recommended the homeopathic medicine Arsenicum album 30. Could it be taken on empty stomach daily for 3 days as prophylactic medicine against the infection, if the medicine is useful for preventing the virus along with the preventive methods?
See, what I have learned all my last 20 years is allopathic medicine. I have no big clue about Ayurveda and homeopathy, but let me tell you, what the world honors, we also must honor. Ayurveda and homeopathy is limited to India. It's good for some kind of diseases. Some kind of treatment done outside your body, Ayurveda is very good. Homeopathy may be good for some kind of diseases, but there are absolutely no studies about Ayurveda or homeopathy treating corona. Arsenic and other kind of things there are a lot of kind of things like that in homeopathy and Ayurveda. We really don't know what effect it makes to your body when it goes inside, and these things have to be secreted out by your kidneys. The heavy toll taken by your body is always by the kidneys. Whatever you eat, whatever you drink, it goes out from your body through the kidneys. There are a lot of heavy metals in this world. Some heavy metals are not being able to excreted by your body. So if it happens to be inside your body, it may harm you, but I cannot recommend or tell you anything regarding arsenicum or anything regarding treatment of coronavirus. There are no proven or no scientific studies with these things.
Thank you for the answer, Doctor. Another question, is there a chance that asymptomatic cases can turn symptomatic?
Yeah. There are people who have turned symptomatic maybe after 14 days. We actually believe that the virus stays in the body only for 10 days actively. But there are people whose immune system are weak and are much stronger. We keep a proportion of 1 to 14 days to see if the infectivity is there. That's why the quarantine has been advised for 14 days. And then again 14 days precaution to prevent any kind of infectivity during the first 14 days of quarantine. That's what Indian government and Kerala government is doing. It's a very good thing. But asymptomatic people can turn symptomatic, but if they have to turn symptomatic, they have to turn symptomatic in the first 14 days. If they are not exposed to any new people or any new virions, in the first 14 days, they will turn symptomatic. If they are not symptomatic in the first 14 days, very, very, very less, maybe very less than 1% chance that further in the coming days, they will turn symptomatic. Thank you.
Another personal question from my side. I just wanted to know if the asymptomatic conditions, people who are asymptomatic and if they are walking around and they are not using any of the precautionary measures that need to be taken, is there a chance that it can communicate from that particular asymptomatic person to another person around them?
Yes, that's a very good question. Asymptomatic people can definitely transmit to a normal individual. Last 2 weeks back, we heard a media briefing by WHO. They were telling that asymptomatic people won't transmit virus. We heard such kind of a news. But again, after a few days, they changed it. They changed it to like very subtle group of people they studied. They came to know that asymptomatic doesn't transmit. But there are a larger group portion they haven't studied. Asymptomatics can definitely transmit the infection as of what we know now. So we cannot take any chance, and all of us have to wear masks and adhere to all these things, because until next year mid, we won't be able to tell anything concrete about this virus. Maybe 2021 mid, we can be sure what will be the future of this virus, and a lot of things will come out in the coming months also. Thank you for that question.
We actually have a lot of questions. In fact, I think we'll keep it short. We are running out of time also. But just one more question that they've asked is it true that exposure to sunlight can kill coronavirus, or is it a myth?
It's totally a myth. You cannot kill any coronavirus in your body. Coronavirus in your body doesn't die by any sunlight or any climatic changes or any decrease or increase in temperature. But some studies are going on in Europe regarding UV light and virions in the surfaces of food packets, on the tables, and UV light exposure. But there is no concrete evidence of killing virus by UV light, because I am staying in Kuwait, the current place in Kuwait. This is, I think, the hottest place on the planet. This place records 55 to 58 degrees of temperature during summer, which is now. There was a saying that you break an egg and put it on a car's bonnet, you get a bullseye or an omelette after 2 or 3 minutes in Kuwait. So in this place, there are plenty of infections happening around. Infections are not limited. We have daily like 1,000 cases. Daily 1,000 cases for such a small place called as Kuwait. Kuwait is like even smaller than Kerala, I should say. We have a lot of cases. So UV light and sunlight is not going to do anything with coronavirus. Thank you.
One more question. I'll promise you that will be the last question I ask. Those who are already asthmatic, do they have a higher risk of corona?
Yeah, definitely. People who have diseases with the lungs and heart, they have a high tendency to acquire the coronavirus. And even if they acquire, their chance of recovering is good, but then it depends upon their lung capacity and the heart's efficiency to pump blood. If they have asthma, I suggest please stay at home, use your inhaler now, and say with the lungs and heart, there is a possibility that you can acquire this virus, and even if you acquire this virus, you will get a pneumonia and myocarditis. So be safe, stay safe everyone, stay at your home. There is no emergency now. Whatever you need, you can be done virtually actually. Everything is possible virtually. So try to be virtual for a while, and we will overcome this together. We shall overcome this together. Thank you.
Thank you, sir.
Hello.
Yeah.
Hello.
Yeah, tell me.
Doctor, myself Pooja. I'm from Kannur.
Yeah, tell me, Pooja.
I have a question. How should we get kids at home? Because my father is leaving home for job morning.
Okay.
And when he came back to home at evening. I have a 5-year boy.
Okay.
And he's starting to playing with his.
Okay, I got the question. And you are scared that if you will get the infection from your dad to your right?
Yes. And almost all families in same situation, doctor. And why? How should we get them? Because they are just 6 years, 5 to 6, 7 years, and that's my question, doctor.
Yeah, it's a very tricky situation. You cannot tell your dad to go to other house or stay outside, or you cannot shut your dad in a room and your kids in another room. So what basically I do is, let me tell you, I stay with my parents now. Both are around 60. I go to a hospital daily. Maybe your father is going to a very less riskier place, and it depends on the workplace also. I am going to a place which is very risky. That's a hospital area. What I do is, let me tell you, I have no kids at home at present. My kid is back in Kerala. So even if kids and elders both have maximum tendency to acquire this virus. So let me tell you, keeping kids along with elderly people who are going for work at this situation is a little tricky situation. We cannot hold them together with us. But the best thing you can do, and what I do also, I'll explain. What you can do is, you can tell your dad who is going for a job to come back with a mask throw the mask, take bath, clean and disinfect his mobile and do everything. And tell your dad to wear a mask all the time when your kid is with you. Mask is the best solution. You wear a mask, tell him to wear a mask when he is at home all the time, wash his hands and clean it. Let me tell you my experience, what I do. When I come back from my job, I leave my shoes outside. That's not because shoes carry virus. I don't want to take any chance. Whatever coming out today from WHO changes the next day. Maybe tomorrow they will say, me, myself, my spectacles will carry virus. So we don't know what is good about this or bad about this virus. I leave my shoes outside. I leave all my dress into a washing machine and I start the washing machine instantly. I take bath the right moment. I clean the toilet with disinfectant. I come out. I disinfect my mobile from my hospital. I disinfect my car keys. I throw away all the tissue papers. I keep my bag at a place, at the bag I take for work at a place where kids or anyone else can touch it. I keep my bag away from everyone. So tell your dad also to keep all his belongings he's taking to his office away from the kid. And if you do things like this, there's a very minute chance only your kid will transmit, but it's very difficult to control kids. But a mask for the kid and also for your dad will be good. For kids, it will be a little bit difficult to put on the mask. Tell your dad to wear the mask all the time. That's the best solution. Thank you.
Okay, thank you, doctor.
Yeah.
Thank you, doctor. Thank you for patiently addressing the questions.
Okay.
May I invite Surya M. Kottaram to formally conclude the session with vote of thanks.
A warm good afternoon to one and all present here. Pandemic is not a word to use lightly or carelessly. It is a word that if misused can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Praying to God to save the world from the current pandemic situation we are all facing today. I come to my duty of expressing gratitude. First of all, I extend our sincere gratitude to Dr. Jibin John Thomas, consultant physician and diabetologist, Abir Hospital and Medical Center, Kuwait, who gave a deep insight how to manage COVID-19 pandemic in a better way. The way he detailed about the physical changes in our life cycle was clear to all the participants, even they are belonging to diverse field. On behalf of the Theresian family, I express my heartfelt gratitude to you, Dr. Jibin. Thank you, sir.
Thank you.
Our beloved director, Reverend Dr. Sister Vinitha, has always been our guiding light, strength, and source of inspiration. Thank you, sister, for all your support. My sincere gratitude to our beloved principal, Dr. Lissy Matthew, who has always been our source of encouragement and a strong pillar of support in all our endeavors. Thank you, ma'am. I am also very grateful to Sister Teresa and Sajimol ma'am, our former principals, for their great support and guidance throughout their activities. We extend our sincere gratitude to all faculty members, medical professionals and students from other institutions for their active participation and support. Sincere thanks to Romley ma'am, our controller of examination, all our mentors, teachers and students from other departments from our college for taking this event a grand success. My wholehearted thanks to Ms. Lekha Srinivas, Center Coordinator, Women's Studies Center, for the immense support for all our activities. Heartfelt thanks to Ms. Annie Thomas Thotan, Head of the Department of Clinical Nutrition and Dietetics, whose master brain made this webinar possible. It is a great pleasure and privilege to work with such a dynamic team of Women's Studies Center. Thank you so much to all my colleagues, especially Ms. Anu Valuran for the beautiful brochure and certificate. Above all, thanks to the God Almighty for making this event possible. Once again, I would like to thank each and every one of you. Thank you all.
Annie, can I tell one thing before leaving? One more thing?
Yes, sure.
I know there are a lot of people I can see in the chat box telling that questions have not been answered. For who all needs their questions to be answered, you can directly approach me in my Facebook page. I'm doing free consultations also in my Facebook page to whoever who is in need of a consultation at this pandemic time. Free consultations have been offered. So you can come to my Facebook page, which is in my name itself, Dr. Jibin John Thomas. You will get all kind of supports there. You can follow me there and ask your questions there. Thank you for bearing with me. Thank you.
Sir, even we had a lot of, in the chat room, we had a lot of people telling that it was a wonderful session, informative, and I would like to convey that also to you. The formal vote of thanks was there, sure, but we had a lot of participants who wanted to let you know that the session was wonderful. Thank you, sir.
Thank you. Bye-bye.